Hello everyone. So today we will be discussing about another important topic for the STEP exams, which is juvenile idiopathic arthritis. So what is juvenile idiopathic arthritis? The word itself tells that it is auto-inflammatory condition which is seen in a childhood. There's one thing that you need to remember, that all the symptoms, especially the arthritis, is going to be occurring before the age of 16, and they should last for at least 6 weeks. So we have three different types. So we will discuss one by one. So first one is the oligoarticular JIA. So we have two girls here. So one girl is standing on 4 bricks and one girl is standing with more bricks. So let's talk about the first type. So the first type is the oligoarticular JIA. Oligoarticular means less joints, and that is why I have shown only 4 bricks here. So there is involvement of less than 5 joints in oligoarticular JIA. And we can see that this girl, her name is Anna, she's holding 2 fingers in one hand and then 4 in another hand. So the age group, or the common age group, is 2 to 4 years, and we can see that she's having knee swelling only on one side, so there is asymmetrical involvement. And then we can see ANA, so it's ANA positive because her name is Anna, and of course she's a female, so it's greater in females compared to males. And then she's saying E, so ESR is high, and we can see that her eyes are red, so anterior uveitis. Then we can see in this bubble she's very sad, so the treatment is non-steroidal anti-inflammatory drugs. And here I have written negative reality. So reality means RF, so we have negative RF factor. Next, coming to the other girl, so she is standing with a lot of bricks. So this is polyarticular JIA. Lot of bricks means more than 5 joints involved. Both the knees are involved. You can see both the knees are having red color here, so that's why it's symmetrical pattern. She also has anterior uveitis. She is also saying E, that's why she is also having increased ESR. And then we have 2 boards, one is 5 and one is 10. So the age group will be 2 to 5 years or 10 to 14 years. And here we can see there are 2 types. So remember, one is the positive bubble, other one is a negative bubble. So it can be either positive rheumatoid factor or a negative rheumatoid factor. And if it is a negative rheumatoid factor, it will be positive ANA. And the treatment here will be non-steroidal anti-inflammatory drugs and methotrexate. Next, this is a systemic JIA, which is also called as still disease. You can see that this boy is literally standing still. That's why it is a still disease. Now here in this image, we can see that this patient is having intermittent fever. You can see this spike. And I've written 2 here. So the fever should be at least there for 2 weeks. Daily fever spikes should be there for at least greater than 2 weeks. Okay, and then we can see there is going to be lymphadenopathy here. So there is generalized lymphadenopathy, and we can see all the serosa is inflamed. So there is serositis. It could be heart or it could be lungs. So it is pleuritis, pericarditis, or peritonitis, or even the peritoneum can be involved. And then we can see here 2 major organs are enlarged, and that is your hepatomegaly and splenomegaly. And then we can see this weird looking rash, which is nothing else but it is a transient salmon pink rash. And here we can see this patient is having arthritis. And we can see it could involve the knee, it could involve the ankle, it could involve the small joints of the hands. And I have written 6 here because this arthritis should at least be there for 6 weeks. And we know that ESR will be high, acute phase reactants will be high, WBCs will be high, platelets will be high. All this because of inflammation. And what do you treat this with? So you're going to use non-steroidal anti-inflammatory drugs because this guy is sad. Thank you.